So let's talk about breast lump in boys. This can be something that can be a huge source of anxiety, especially among teenage boys from the age of 12 and upwards. You might notice increase in breast enlargement in either one or more of your breasts. It can be the left breast, it can be both the left and the right breast. The breast can also feel tender to touch, it can feel lumpy, and your main concern is, could this be cancer? However, this is highly unlikely to be cancer, as this is just a common process in your development and is usually due to hormonal changes in your body. As you're well aware, when you're going through the stages of puberty, you have your testosterone levels. Your testosterone levels is what's responsible for the deepening of your boys, your hair growth distribution on your chest, your abdomen, increasing your genitals, your reproductive function, as well as other changes in your body. Now, women have what they call estrogen, which is responsible for the hormonal changes in their body, such as their own breast development. In boys, we do have a small amount of estrogen, but what happens is when we have higher amounts of estrogen that we normally should have, this now leads to hormonal imbalance in the body, where there is an imbalance between the levels of testosterone and estrogen, and this is what leads to the breast lumps that we see in boys. So what happens is if you have more estrogen than you normally should, you might notice that your breast is a bit lumpy to touch, could be slightly tender to touch as well, and is what we call breast buds. Now you're anxious thinking, oh no, I've got a breast lump, could this be cancer? In a 12-year-old, unlikely to be cancer. I say unlikely because there is always a small percentage, so I can never say never, but unlikely to be cancer. If this is something that's persistent, that has been going on for a few years, or you might notice any other changes such as maybe a milky discharge from the nipple, bloody discharge from the nipple, you notice any skin changes like an orange appearance to the nipple, any eczema changes to the nipple that you have not noticed previously, then perhaps it's the time to now visit your doctor so your doctor can do an examination to make sure that there is nothing sinister going on. Apart from normal hormonal imbalance, there are other causes that can cause breast lumps in your body, such as increased weight gain. If you're obese, you're more likely to have fatty tissue in your breast that feels like breast lumps. If you're taking certain drugs or recreational supplements, whether it's anabolic steroids, that can cause abnormal breast development, as well as heroine, amphetamines, marijuana, and other recreational substances. Also, there might be underlying health conditions such as a thyroid disease, kidney disease, liver disease, and be aware of a condition called gynecomastia, which is basically the hormonal imbalance between the testosterone and the estrogen, which is more due to medical underlying causes, as opposed to gynecomastia, which is more due to your hormonal imbalance that happens through puberty. And as it happens through puberty, this is likely to resolve over time. There is no age range. It could be by the time you're 13, it could be by the time you're 16 or 17. Everyone has their own different stages. Some have breast buds at a later stage, maybe by the age of 15 or 16, and some have breast buds much earlier by the time they're age 12 or 13. Now, I hope you enjoyed this video. Please feel free to share, like, and subscribe.